TRT World's health correspondent Nicola Hill joins us now with more. Nicola, the CDC advice, walk us through what changed and what happened there.
So on Friday, the CDC changed the wording on its website about the advice. And this led to a lot of the US media in particular thinking there had been more science showing that we couldn't catch the virus from surfaces. If you remember, we've all been told that the virus is viable on cardboard for about 24 hours and on plastic and stainless steel for up to 3 days. So, of course, this caused a flurry of excitement because we're all worried about if we touch something, a door handle, or if we go shopping, are we going to catch the virus? So the CDC realised this, so it's now sent out a media release, and it changed the wording again on its website. And the wording actually says, and if I read it to you, it says, it may be possible that a person can get COVID-19 by touching a surface or object that has the virus on it, and then touching their own mouth, nose, or possibly their eyes. But this isn't thought to be the main way the virus spreads. And that's what's important here. What they're basically saying is that COVID-19 is a respiratory illness. Its main method of transmission is by droplets, virus droplets, when somebody breathes, sneezes, coughs, speaks, sings. And anybody who is very close to them can possibly then inhale those droplets and become infected. And that's why the advice about social distancing, physical distancing, remains really important, as does covering your nose or your mouth if you're going to cough or sneeze, or wearing masks, which more of us are being told to do all the time.
Nicola, help us out. The CDC say it may be possible. I'm confused because, and so many of our viewers, I'm sure, you get your shopping, you get packages. Even my studio here, I spend a long time wiping down the surfaces, the keyboard, the mouse. What should we do with our shopping, with our packages? What should I do in the studio?
In the studio, continue with the hygiene, and the CDC is saying that we should still maintain our hygiene, wash our hands regularly and wipe our surfaces, not only to prevent the coronavirus, but actually to prevent other viruses and germs. But food microbiologists are saying that we shouldn't necessarily have to wipe down our shopping. You know, when we go and do the weekly shop and we're going to the supermarket, we don't have to clean it all when we come inside. But I was speaking to Professor Martin Bachmann this morning. He's from the University of Bern in Switzerland. He says it is unlikely that you're going to catch it from a surface. But he reminded me of the research that did come out earlier from a person who worked in a car plant factory in Germany, and they found that they did catch the virus. They were infected because they used a salt mill, a salt shaker, that had been used by somebody who worked in the car plant factory who'd come back from China and was asymptomatic. So it's not completely safe, and that's why you should still wash down your surfaces. You should still be, maintain that hygiene. But the main way of catching this virus from an infected person is still through the respiratory droplets. And that's if somebody is talking loudly or singing, because we know that if you talk loudly, if you sing, it's more likely to spread because it goes further, but just speaking or breathing. And that's why we have to keep this distance, this social distance. And the other interesting thing that Professor Bachmann told me was the fact that what they still don't know is why some people are super spreaders, why there are some people who can infect a whole group of people nearby, whereas the actual chance of catching the virus within a household is 15%. So other people who are infected, they can be sleeping next to their wife or their husband, and they don't infect them at all. So a lot more research needs to be carried out. But I think, Maria, we're told at the moment we don't need to wipe down our shopping, but we do need to continue with our hand hygiene and cleaning our surfaces.
Nicola Hill in London, thank you very much indeed.